Welcome to this event, this evening's discussion on measuring well-being, part of the Office for National Statistics' nationwide debate. It's time we admitted that there's more to life than money, a fresh-faced politician by the name of David Cameron announced in 2006. It's time we focused not on GDP, but on GWB, general well-being.
There's different approaches to well-being. We think that we can draw from each of those approaches that I've outlined, and I think actually all are needed actually to get a full picture of the nation's well-being. We think that actually they're all important, but we want to know what you think, what the important aspects of well-being that you think there are, and also perhaps how you think it should be measured. And so I think that's why we're here tonight, to discuss those things.
Well, I feel I'm a fraud here because I'm not really very interested in measures of well-being. I'm interested in some of their determinants. I've spent my time looking at inequality as one of the components of well-being, and I think there are also really powerful psychosocial effects of inequality, related more to feelings, if you like, of superiority and inferiority, and the pain of feeling looked down on and taken for granted.
Well, working in mental health, I guess I have a fairly specific perspective on well-being, perhaps a much narrower. I would see well-being as the kind of core definition of subjective well-being, including both affective and cognitive elements, affective elements relating to happiness and contentment, while cognitive aspects relating more to life satisfaction. It's influenced also by intrinsic factors, such as people's personality, their styles of coping, differences in personal resilience, possibly even genetic predispositions.
I work on developing countries, so I've got relatively little knowledge of what's happening in the UK. And to make things even more complicated, we have, over the last 15 years, inverted the concept, and we've focused rather exclusively on poverty or ill-being. One of the things that is actually interesting when you invert this and you look at poor people is you find out that poor people are not miserable, but in their day-to-day lives, then actually the children play. They sing songs, they have games, they crack jokes. They're not content, but they are enjoying their lives in the ways that they can afford, in the ways that they find culturally relevant and socially valued.
Let me tell you, because they haven't been said yet, the ONS well-being questions that are proposed. Overall, how satisfied are you with your life nowadays? That's the first. Second, overall, how happy did you feel yesterday? Third, overall, how anxious did you feel yesterday? And finally, overall, to what extent do you feel the things you do in your life are worthwhile? It's all very different from the way I was taught economics. I must say I was raised as a student in the 1970s, and explicitly or implicitly I was encouraged to think that if you can count the number of pound notes on the table that a person has, then you've come very close to measuring their utility.
The social status and how much people are valued is seen as a component of well-being, and obviously people stressed how that's distinct from income, but I was wondering how the panel thought whether or not it could be separated out from relative income.
I think really to know how important relative income is for whole societies, you've got to compare inequality across the whole society. Basically, I think what inequality is doing is fueling the class differences. People often talk about wanting a classless society, but to think that you can create a classless society without reducing income differences is a bit like thinking you can get thin without worrying about calories.
What intrigues me from that is David Cameron's espousal of happiness and well-being. How sincere is it? How committed is he really to well-being? Because it seems to me that the Tories and the present government are not committed to reducing inequality.
And he was asked by one of my colleagues whether, if the evidence demonstrated, for instance, that progressive taxation was good for happiness, that he would go with it, and he actually said he would.
And I was just going to ask about whether the happiness of future generations should be discounted, or the kind of their happiness points, if you like.
In terms of well-being, I think we need to think about not only current well-being, but also future well-being. And I think the Stiglitz 10 for 2C report quite nicely says that those two things should be separate, and that you should measure them separately.
And I have in mind another well-being survey that already exists, the National Student Survey. When you analyse the results, you find that 90% of the variation is attributable to individual student differences and 2% to the effect of different universities. And all the public discussion is of the 2%, and it's used to create entirely spurious league tables of universities with greater or lesser degrees of student satisfaction.
In most happiness and life satisfaction and mental health equations, we can explain about maybe 8% of the variance, perhaps 10% by the things that seem to happen to people. So that's a lot more than the 2%. But it still means that a vast amount of the variation, as in all morbidity equations, all lifespan equations, the vast bulk is coming from things we don't understand, genes, maybe personality, who knows.
It seems to me that populations are kind of tired of the chattering classes of academics like myself, of politicians in particular, telling the population what's good for them. What's great about this, it seems to me, is it's actually people expressing what makes them happy, and then other people objectively looking at the data and saying, well, these people who have all got red hair are reporting higher levels of happiness. People living by the sea are reporting it. These people who are living in bad housing are reporting lower levels. That seems to me like the perfect way.
What she's saying is that actually it's good that we just ask people how they feel, rather than, so we can actually get a handle on it from real ordinary people, rather than scientists going, well, actually you're probably unhappy because you've only got one BMW.
But I do think individuals don't know, and that's really important.
Politicians around the world want evidence-based policy, but they present it as though you can have evidence without theory or ideology. And that's because it makes them non-accountable. Evidence-based policy is ideal for politicians, because if it works, vote for me. If it doesn't work, it was a bad scientist.
Your panel was Andrew Oswald, Stephen Stansfield, Stephen Hicks, Richard Wilkinson and David Hume. I'm going to finish with a quotation from the other David Hume, who said, "He is happy whom circumstances suit his temper, but he is more excellent who suits his temper to any circumstance." Good advice. If you'd like to show your appreciation to the panel. Thank you very much indeed.